Hello, this is Dr. David Green, CEO of the Texas Pain Network. Today's topic is what you need to know about facet injections. Well, what is a facet joint? First of all, these are small, thumbnail-sized joints that are located on either side of the back of the spine, all the way from the neck down to the sacrum. Okay? They do contain cartilage, just like a hip joint or a knee joint. Together, all these facet joints, there's over 40 of them, combine for an incredible range of motion of our spines that we enjoy. So facet joints are prone to arthritis just like other cartilaginous joints, and even though they are small, about the size of a thumbnail, they can cause an incredible amount of pain. And usually it leads to pain in the vicinity of the arthritic joint, but often patients have several arthritic joints at the same time. So here you see one, here you see one, here you see one. So it's just a matter of which ones are actually causing the pain. So here you see a view from the side of facet joints. This one looks kind of normal, but here you have bony overgrowth. The redness denotes inflammation. Okay, same down here. And eventually this bony overgrowth can start to pinch on nerve roots as they're trying to get out from the spine. So why are facet injections performed? There's really not a great surgical answer for symptomatic arthritis in the facets. We don't have a surgical facet replacement. Okay. There are excellent non-operative options, and facet joints do respond well to steroid injections. So it's an outpatient procedure. It only takes about 10-20 minutes. Modern pain doctors will use fluoroscopy, which is real-time X-ray guidance. IV sedation is usually not necessary. You're not even going into the spinal canal. They're just going to the joint over here. Usually the skin is numbed up and all the soft tissues down to the area. The needle is placed into the joint, and then some dye is usually placed to make sure that it's actually in the joint. And the pain doctor will place some steroid and some numbing medicine into the joint. Several levels can be treated at the same time, and the procedure can be repeated every few months. Usually the numbing medicine works right away, and then the steroid medication kicks in within 2 to 3 days. 82% of patients receive pain relief with facet blocks, and over 50% is the amount of pain relief that they get. Significant functional improvement was seen in 78%, and that's with or without steroid. So it's unclear whether the steroid is even necessary. The average duration of pain relief was almost 4 months. The same results have been seen in several studies, and the procedure is just an excellent non-operative method of achieving neck or back pain relief due to spinal arthritis. If the pain returns, there are 3 treatment options. One is the facet injection can simply be repeated. Another is the pain doctor can perform what's known as a medial branch block. And the third is to simply move on to a radiofrequency ablation. This is a radiofrequency ablation. The catheter is being put in and heated up, and these little nerve endings are being deadened. All right, so instead of the needle going actually into the facet joint, it comes out here, and it can provide pain relief for 6 to 18 months. It's been an amazing procedure for pain management. The risks with facet blocks are extremely low. There's a very slight risk of infection, bleeding, or possibly an allergic reaction. Remember, the needle does not go into the epidural space. You're not around the spinal cord. You're not really even close to nerve roots, so there's a negligible risk of injury to either of those. The top non-operative pain management in Texas is through the Texas Pain Network. There are several clinics throughout the state, including Austin, where over 50 insurances are accepted and over 25 treatment options are provided with the board-certified physicians. For Austin treatment, visit us online at painmanagementaustintx.com, and then call us for more information and scheduling at 512-456-8886. I'm Dr. David Green with the Texas Pain Network. Your pain stops here.